The lead Democrat on the Senate Health and Human Services Committee, Tony Lourey, joins me to talk about the health care insurance exchange and a little bit more about broad reform. Thanks for joining us again.
Absolutely, Julie. Always a pleasure.
And Senator, when we talked to you about a month and a half ago, we asked you a little bit about the insurance exchange issue. And at that time, you said that because last session was a budget year, policy issues, particularly the insurance exchange, were kind of placed on the back burner. So as we head into session now, where do you think it's going to rank on the priority list?
Well, this is a policy year, and so I think that we will have a bit more time. I don't think it's any big secret that our state's fiscal forecast might give us a little bit of budget work to do again this cycle, and Health and Human Services may play a role in that as well, and so that might complicate matters. But that being said, health insurance exchange is something that is going to happen. It's the law of the land right now, and the debate is whether we have a Minnesota-based exchange or whether we let the feds roll in and implement a federal-based exchange. And with all of the historic, really good work Minnesota has done at improving cost, quality, and access to health care, I think that it would be a real missed opportunity if we didn't work together, sit down, and hammer out a Minnesota-based exchange. And so I think that's pretty widely understood, and hope that we can really get on with that discussion and do some good work for the people of Minnesota.
GOP leaders, including Chair David Hann, have said that they believe that the legislature should have a significant role in establishing this exchange. You've said the same thing. Do you think that the current legislative majority should have a dominant role in this?
Well, I mean, it's part of the process. I mean, we have a split government. We've always had a split government. Maybe not always, but my entire recollection, we've even had tripartisan government for a period, and it's all about sitting down and working together. They have a very significant role to play. One of the things I think that, they're probably going to have trouble passing a bill just with their members. They don't have that big a majority, and they have some members that are, incredibly opposed to the whole idea. And they're probably not going to bring them along. So they're going to have to look to us for some votes. And, Chair Hann and I sat down and had lunch last week and just had a talk about how we do better working together as a legislature rather than fighting all the time. And I hope that we're able to make some real progress on that. So our caucus is going to, if this is going to come to pass, our caucus is going to have to probably put up some of the votes. Governor Dayton, a Democrat, will have to sign it. But the Republicans do run the show, the majority. They hold the majority in both bodies of the legislature, so they will have significant say as well. But it's all about sitting down, trying to be reasonable, and talking about what is in the best interest of the people of Minnesota moving forward. And I think a strong Minnesota-based exchange with good oversight that ensures accountability and transparency can really go a long way to providing, again, quality, affordable, accessible health care to more Minnesotans.
And as lead minority on the HHS committee, then, your role will obviously be significant to try to pull your caucus in. Have you had those discussions yet with folks from the DFL on the exchange issue and on reform in general? Yeah,
we haven't had a lot of caucus meetings with me as lead. That came about just, a few weeks ago. But it is an ongoing discussion. Health insurance exchange, this concept is not new. This concept has been around for many, many years. And we had, I was always a member of the Healthcare Access Commission, and we had a subgroup working on healthcare exchanges forever, and they predated that even. Truthfully, I believe the genesis of the healthcare exchanges was the Freedom Foundation, a right-wing group. So these have been around for a long time. I think a Minnesota-based one makes a good deal of sense, and I think that if we can sit down and have an open and honest dialogue about it, we can all get together and figure out, again, what's good for the people of Minnesota and work together to see that happen. That's my hope.
Okay, Senator, we're almost out of time, but I have to ask, of course, one of your priorities thus far has been to provide more affordable health care. So what recommendations would you like to see coming from the task force that is charged with trying to overhaul the entire system?
Well, again, a strong exchange is going to be one of the really big jobs to get through this, and making sure that it has the best interests of people of Minnesota in mind as it moves forward. Again, transparency, accountability to ensure that that the products that are on the market that people are going to be utilizing to access health care help them get better health care at a better cost.
Okay, Senator, we're out of time, unfortunately, but of course we'll get you on during session. We appreciate your time.
I look forward to it. Thanks, Julie.